Um, Good morning, everyone. It's early. Um, I did this once, and I completely zoned out into another space world. So I'm trying not to today. I picked up my antibiotics and started them this morning. It's Oh Lord, bear with me, guys, and I'll explain. It's Flagyl, Rifram, and doxycycline. Um, and some you could take with food, some you can't, or some with milk, whatever. And I've already went online, and my pharmacist also told me it don't counter react with my herbs nor the other medication I have. And I'm just gonna be honest today or this morning, I don't know what it is. Maybe it was just the trip from yesterday, which was exhausting because that made my third time ever driving. And again, my doctor advised me not to drive. And I mean, I'm going to be moving within the next couple weeks, so the transportation can find me at my my new address, because they can't seem to find me out here, out in the boondocks. So and I'll be moved before my next appointment, which I got 4 in a row in 2 weeks' time. So, and I'm moving in the couple. I'm moving within the next couple weeks, so then I won't have to worry about it. Because to be honest, my mind's getting worse, and I'm zapping out more, and I'm not getting to enjoy the vacation that's going on. Um, Also, yesterday we did another CT and X-ray, and I mean, I've had granulomatosis disease, obviously back in 2014, and doctors didn't tell me I had it, but it formed a lot of granulomas in my lungs. Not enough to do surgery, but as of yesterday, they showed more new forms of granulomas forming in my lungs, which the granulomas turn to cement rocks, and it's taking more space out of my lungs, where it's making it harder to breathe, and I'm having to stay on my nebulizer now. And she's prescribed, which I pick up this weekend, a handheld breather where you can put drops in it, and it'll help with me with my lungs being with more granulomas forming in it. And also maybe the antibiotic, she said, might help slow the process of it down, because Monday, out of nowhere afternoon, my husband, thank God, he came home, and out of nowhere, it was like his car sat on me, and I stopped breathing. It was like I was breathing underwater, and no matter how hard I tried, I could not catch breath. And I mean, it pretty much made me pass out. And this morning, I did the same thing again. It wasn't as bad as Mondays, and that's why I said, I mean, I tried recording earlier, and I had an attack, and I walked from here to my car that we just brought back from my parents' house, and it got me. So I'm not being able to really walk too much without my lungs feeling like they're being filled up with air, and I'm trying to breathe in air. So I'm having to keep my nebulizer in my pocket at all times and she said to just keep doing it until I can actually catch my breath. And so that's why I said I recorded previous, but I had an attack in the middle of it, and I had to completely just take that whole video out. So now I'm having to fight that disease, lung disease, again, because like I said, I've treated it before, and well, I didn't treat it before. I didn't even know I had it. and so, but this time I do know that it's active again, because they said it was dormant. It didn't show it was forming back last year. No, in December of last year. So, I mean, obviously it's come back out and decided to kick my ass. Excuse my grammar. Um, I'm also, I talked to a young lady, and I was talking to her about my seizures I'm having, the brain seizures. And, she said that you don't have seizures when you're in treatment for Lyme or Rocky Mountain spotted fever or any co-infection. I will be the first one to tell you that's a lie. That is a straight up lie. Because, I mean, I've got my paperwork right here that I got yesterday, and it is diagnosed I am having seizures, and I'm on treatment. So that is not true. Now, some people on treatment stop if they have seizures. I, for one, am so far chronic, where, and I know a lot of us who are chronic, where it not just, you just don't have the Lyme, and you just don't have the co-infection. If you've had it for years, and we all know it digs deep, and it starts affecting everything in your body: heart, lungs, brain. And treatment, sometimes, even though it helps, it cannot repair the damage. And I've got too much damage from having this disease before I was diagnosed and treated, that it's no amount of treatment is helping it. I'll put it like that. So, yes, you can have seizures and be on treatment at the same time. So I'm just gonna be the first one to pour that out. Um, Today I'm very, very dopey, and I'm not even took my shots yet, because, I mean, you can't sleep for 3 hours after I take my whole bag of shots, and I am so, my body, I mean, you can't see it. I don't know if you really can or not, but my insides feel like they're vibrating and tremoring. So it's very hard to keep concentrate. Is that the word? It's very hard to concentrate when you feel your whole body doing this. And then on top of these completely out of nowhere, no, it's not anxiety, it's not air hunger, it's not panic attacks, just out of anywhere, just these episodes of where I can't breathe, or I feel like I'm breathing in water, underwater attacks, and some I do pass out recently. It literally zaps all my energy when I have these attacks. And I mean, they just started. These really, I've had to deal with the breather for the past lung issue of the disease to help me breathe, and obviously with it forming more granulomas, it's making it more and more harder for me to do what I was doing on previous videos of being on good days, being active. And if I feel good, now I'm having to, like, right now I gotta calm down. Now it's keeping me from doing simple tasks of literally getting up from this table and walking to the bathroom or ice box. It's causing horrible attacks, and I mean, some of them are bad. And then on top of that, these completely disconnected from your body seizures I'm having. And I'm like, right now, I mean, in my stomach, everything's just screwing up on me. So, what, I don't know if you guys just noticed this, the like a glitch where one minute I'm saying something and the next minute I'm not. I stopped this post 10 minutes in, which was at 9:20, and I'm just now unpausing it to finish it. Excuse me, I've got to take this nausea medicine. I'm having still the oh, lemon water. My internal intestinal spasms are getting worse where it's, I mean, I've told you guys about the bathroom issue where the internal organ, my GI tract is so screwed up. And I know when we hurts, and I know this is going to be sick, but it's sad and we have to do this. When we go through our hurts and we usually are pass, it's because the old cells are dying and that you pass them one way or another. And I know I was passing for this past whole month. Since last month, I know I've been passing because if you guys pay attention, you know they look like little sesame seeds. When you see sesame seeds, yeah, you know you're passing it. Or a mucusy. Read up if you don't know what I'm talking about. But if you do, you know what I'm talking about. But today, and I mean, I've been having where like I said, I stopped at 9:20 and it's 10 o'clock now. That's how long I've been. And it's not just using the bathroom, it's in there making it where you feel like you have to go, but you're not. And your intestines are so severely having internal spasms right down all the way in your guts and your small and large intestines where you're in pain. And I don't want that seen on here because that's just something I don't want to let know. And when I'm done with this doctor, yeah, when I'm done with this video, I actually need to call my doctor because and like I said, I just started my antibiotics this morning. About, well, it's 10 o'clock. I start 7 to 8, 9, 3 hours ago. But before I started taking even took any of my medication, I was having these internal intestinal spasms and in the bathroom. And today, and I'm going to have to call her because I mean, the first time I started passing blood, it wasn't that much. But today, since this morning, I am really passing a lot of blood, and it's not hernias or or hemorrhoids or any of that. It's because that would this is gonna be a disgusting topic right here. It's not around your fecal matter. It's in it, literally in it, and I'm showing a lot of blood in my fecal matter, and I've not really done that ever. Light, yes, but this is hard and heavy, and on top of that with loose, watery diarrhea, and I've had it for, oh my God, going on 3 months now, nonstop. I'm that makes me worry, and I honestly forgot to ask her about doing the endoscopy and the going in and up both ends of your body and checking my intestines. I completely forgot that. So I'm going to call her when I get done here. I personally don't remember if I've discussed about the seizure part at all. I'm like I said, and like I just took my nausea medicine and I've got saltine crackers sitting here because I am so severely nauseous. And she gave me a prescription on top of my friend giving me vinegar, and she gave me a prescription of that so I can. Ugh. It's bad. Also, my migraines, when it comes to migraines, my insurance approved Botox, not the injections that make your face look good. The Botox for your migraines, and where they start here and go all the way around. And I'm supposed to start them next month. Yeah, next month, and it's to do it once a month. So my insurance approved it. So now I got to just get. She's trying to find a doctor that does the Botox shots for migraines. So hopefully it will work, because the migraine medicine she has me on, migraine/seizure medicine, is not working, and then she'll just put me on a seizure pill again. Um, Cycling, something like that. I've been on it before, and on top of the Botox migraine shots, um, which will be a first for me. But when I get off here, yeah, I'm gonna have to call her about the intestinal issue that's going on, and I'm not going to get much done today. I know I need to take my shots. God, I do. But I'm going to pass out. I know I'm going to fall asleep, and I'm not allowed to for 3 hours, and that scares me. And my husband now, he's scared to leave me at home now because of the lung issue, because I mean it could literally, if you look up the disease with the granulomas, and if it's active, and as they grow, or if they move in your lungs, it could block off your lung airway altogether, and it could kill you. It really could. And I'm not gonna cry up on this video, because because I don't need to cry, and I'm trying to calm. Right now, I feel like a car is sitting on my chest, or right here at my breastplate, and it's burning. And I'm trying to stay as calm as possible through all this. So excuse me if you see me rubbing. It's nothing meant to show off anything. It's just, but it scares him now to leave me here, because I'm having these attacks more and more, and there is a possibility that it could block my lung chamber from being able to get air at all. And I'm so highly, I'm having major sensory issues right now, where TV, music, I mean, yes, I let my husband go out Friday night or Saturday night. I think I posted Saturday, but it was actually Friday, and it was such a sensory overload where I felt all I wanted to do was run, if that makes any sense. I had to get away from it. That sun hurts. Because I'm not supposed to be in the sun, but that sun's burning bad. Um, Sorry, guys. I'm just trying to calm down real quick. Because, like I said, I've had attack Monday, and I just had one less than about an hour. I had one about an hour and a half ago. And then with this internal, constantly in the bathroom issue I'm going through, and having to call my doctor for that just in a few minutes. It's a lot to take in. And then on top of it, we'll be moving in a couple weeks, and obviously the woman is selling the property. Well, she's splitting it up and selling it off, and so many people are coming up into the property, because usually I don't lock the gate during the day, and people are coming up on the property wanting to view it while we're here, and I'm not liking it. So now I've got the gate locked, and somebody this morning pulled up at the gate, got out, and started walking in the woods, and I walked about 150 feet and had another attack where it felt like I was breathing underwater again. So that's stressing me out. And then the lung issue, the blood issue, and then being back on antibiotics when I've been on them before, and I know how severely sick I got. And I mean, I got sick, sick. So I will apologize starting today. If I'm not on here like I used to, it used to be a post once a day, and then it's went to where it's every 3 to 4 days, and this time it was a 7 day span minus the 5 minute one. I'm going to try through this to at least do 1 or 2 posts a week. But I mean, it may go down to just one because I know how severely ill I got no matter how much I detoxed. And I do mean followed the whole paleo, gluten free, you name it, Bruner and all this. I mean, I know I got severely, very ill where I couldn't really do anything. And that's also like with my lung issue of having these attacks, it's actually affecting my speaking. So I don't know if you guys can hear it, but my voice is very low or hoarse, and it's not from yelling or anything. Obviously, for some reason, having these attacks has messed up my vocal cords, and now I'm constantly hoarse. So I don't know what's going on with that either. But I'm going to wrap this up because I know I need to take my shots, but yet I know I'm going to pass out. So I'm probably not going to take them, and I'm going to take what bit of energy I've got and get to that couch, and I'll just take my shots this afternoon. But I love you guys. Prayers to you all. May you all have a good day. May you all have a blessed week. Look for the silver lining, because if you don't, no one else will. Send some prayers back my way, because this is, I know for a fact, been there, done that, and I know this is not going to be fun. So I love you all, and God bless.